Hi, today I'm going to be talking about soda tax. So a soda tax is a taxation placed on sugar-sweetened beverages. The drinks that can be included are soda, regular or diet, non-100% fruit drinks, sports drinks, sweetened water, energy drinks, pre-sweetened coffee or tea, and non-alcoholic beverages intended to be mixed into an alcoholic drink. Proponents of the soda tax believe that it could help with the current obesity epidemic sweeping not only our nation, but worldwide.
The World Health Organization found that since 1975, worldwide obesity has almost tripled. As of 2015, 68% of Americans are considered overweight or obese. The CDC found that in 2015 to 2016, 39.6% of adults and 18.5% of children in America are obese. By comparison, in 1976 to 1980, only 15% of adults and 5.5% of children were obese.
Currently, Americans are consuming 39% more added sugars in our diet than we did 50 years ago.
The World Health Organization has urged that we need to cut back on sugar, limiting added sugars to no more than 10% of our daily calories, which is equivalent to about 12 teaspoons of sugar. The American Heart Association recommends an added sugar limit of no more than 100 calories per day for most women and no more than 150 calories per day for most men. The average can of sugary drink can contain around 40 grams of sugar, which is the equivalent to about 10 teaspoons of sugar.
Many public health advocates aren't convinced that education about the negative health impacts of sugary drinks is enough. A soda tax may give consumers the nudge to stop purchasing these empty-calorie, sugar-packed drinks. Preventing obesity when we can, rather than paying for its consequences, makes good economic and public health sense. For the tax to work, consumers need to see the price of the sugary drinks going up. This means an excise tax should be used. With excise taxes, the manufacturers or distributors of the sugary drinks pay the taxes, and they pass the cost on to the consumer by raising the prices of the product. State and federal excise taxes on tobacco and alcohol have helped to decrease consumption, so local governments assume a soda tax will work in the same way. Like I've already stated, proponents of the soda tax believe it may help decrease the incidence of obesity and type 2 diabetes. The taxation of sugar-sweetened beverages would decrease consumption because price is a key determinant of a beverage or food choice, especially a beverage choice that isn't considered a necessity. The revenue from the taxation of sugary drinks could be spent on obesity prevention programs, set up children's health promotion funds, or nutrition education programs in schools or communities. The revenues could be used in many different health-focused areas. In 2014, the Mexican government passed a 1 peso per liter excise tax on any non-alcoholic beverage with added sugar. This taxation increased the price for the consumer by about 10%.
An evaluation after the first 2 years of implementation showed that there was an average reduction of about 7.6% in the purchase of sugary drinks, and that households of low income had an average reduction of about 11.7% in purchases. There was also an increase in the purchasing of bottled water of about 2.1%. In terms of the US dollar, about $6 billion was raised within this time period, and some of the revenue is being used to invest in installing water fountains in schools across Mexico. Currently in the United States, there are 7 cities which have introduced and partake in a sugar-sweetened beverage tax. These include Berkeley, California, San Francisco, California, Oakland, California, Albany, California, Boulder, Colorado, Philadelphia, Pennsylvania, and Seattle, Washington.
Berkeley was the first city to pass the nation's first soda tax on sugar-sweetened beverages, which took effect in March of 2015. Voters who approved the soda tax focused on how this implementation would help to fight obesity and type 2 diabetes. Within the first year of the soda tax, sugar-sweetened beverage sales dropped by almost 10% and dropped by almost 20% in some neighborhoods. It has raised around $1.4 million for children nutrition and community health programs. A study done by researchers at the University of North Carolina's Gillings School of Global Public Health and the Public Health Institute of Oakland found that 1 year after the sugar-sweetened beverage tax was implemented in Berkeley, residents drank less sugary drinks and more water, milk, and other healthier beverages. Average consumer grocery bills did not rise, and local store revenues did not fall despite soda company warnings, and the tax raised money for health education programs.
Lead author of the study, Dr. Lynn Silver, stated, "The Berkeley tax is a home run. It helped residents make healthier choices, it raised revenue for promoting health, and we saw no evidence of higher grocery bills for consumers or harm to local business revenue. These findings confirm that sugary drink taxes make health and economic sense at a time when obesity and diabetes epidemics are sweeping our communities and healthcare spending is threatened."
Philadelphia is the largest city in America with a soda tax. The soda tax came into effect in January 1st of 2017. They taxed soda at 1.5 cents per ounce, which increased the cost of sugar-sweetened beverages by almost 20%. Results were similar to Berkeley's, but had a strong impact within the first 2 months. Unlike Berkeley's soda tax, Philadelphia's wasn't solely passed for health reasons, but rather to increase revenue for the city to fund pre-kindergarten programs, parks, libraries, and other services, especially within communities that lived in poverty. It raised around $79 million in the first year of implementation. Boulder, Colorado introduced a 2-cent per ounce soda tax that went into effect in July of 2017. The revenue generated from this taxation will be spent on health promotion, general wellness programs, and chronic disease prevention that will improve health equity. Also, many health programs were really targeted to helping residents of low income and those affected by chronic diseases linked to sugar-sweetened beverage consumption. Seattle, Washington implemented a $1.75 per ounce soda tax that went into effect in January of 2018. It has raised $10 million in the first 6 months of implementation. Seattle is considering using the revenue that has been generated from the soda tax to expand their Fresh Bucks program. This Seattle program helps families of low income that do not qualify for food stamps buy fresh produce at farmers markets. Opponents of the soda tax argue that increasing the price of soda to decrease consumption through excise taxes only work if retailers pass along the added cost to customers, which doesn't always happen. The Harvard Business Review found that in Berkeley, much of the cost of the tax was not being passed along to customers. They also estimated that half of the reduced consumption was offset by increased consumption at nearby supermarkets, where there was no soda tax. Local Philadelphia business owners have been losing sales and needing to cut hours and reduce costs because the soda tax is driving customers across city lines. A spokesperson for the Axe the Philly Bev Tax Coalition stated that the tax hurts the local economy and is bad for working families. PepsiCo has also announced layoffs within their company, which they say is also directly related to the Philadelphia soda tax. In other cities with soda tax, people have also claimed that soda consumption has not decreased. Rather, people aren't buying the soda locally, but driving into neighboring cities to not only buy soda, but to also purchase groceries and gas. When Cook County, Illinois, the county that includes Chicago, enacted a soda tax, it only lasted 2 months before it was repealed. People of Cook County were telling their board commissioner, John Daly, that they were going to Indiana to buy soda and all other groceries. The revenue generated from the soda tax shrank each month and didn't meet the expected quota. Repealing the soda tax created a $200 million budget hole in the county. To make up for this budget hole, program cuts and 321 layoffs have been called for. The American Beverage Association suggests that it disproportionately affects shoppers of low income. A soda tax isn't going to deter the rich from continuing to buy soda, but it is unfair to people who cannot afford to work their way around the tax. The health benefits that are supposed to be promoted within the population by the curb in the consumption of sugary drinks isn't a given. Just because people have stopped buying and consuming sugary beverages doesn't mean they won't be able to find more calories elsewhere. The momentum of the soda tax movement has also been halted in California, home of 4 cities that have enacted the tax. In June of 2018, California introduced and signed into law a ban that doesn't allow any new food or beverage taxes to be passed in the state until 2031. The American Beverage Association says this ban will protect consumers and retailers from unexpected price hikes.
William Dermody, the American Beverage Association's Vice President of Policy, says their aim is to work with public health communities and government officials to help Californians reduce sugar consumption in ways that don't cost jobs or hurt the small businesses that are so important to local communities.
In conclusion, is a soda tax the best way to combat the current health epidemics of obesity and other chronic, non-communicable diseases? Will it raise enough revenue to generate new health policies and also curb sugary drink consumption enough to see real changes? Can a soda tax generate sustainable changes within our food system? Or are soda taxes a lackluster idea that will only generate job loss, local economic deficits, and only affect people of low income?